Yes,
Yes, can you hear me?
very well. Over
Oh,
to you.
thank you so much, my brother, Dr. Breda, for your kind introduction. And I would also like to thank the AMF for the invitation, but especially the president of the medical school, my also good friend, Professor Kyriakos Anastasiadis, to join this important event, but not only to join this important event, but for all his efforts for more than a year now, together with Professor Fountoulakis and Professor Chourdakis, to make this collaborating center a practical reality. And we are looking so much forward as WHO Europe to work together in the many years to come. And as Joao already mentioned, we are looking very much forward in the very near future to have the official inauguration of the collaborating center. Can I have my first slide, please? The introductory one, please. Just before that. Thank you. Thank you. I just want a personal note here that as a Helen abroad myself, it is a true honor, my dear President, Professor Anastasiadis, and privilege to be with such a high caliber pool of fellow compatriots. And thank you so much that for a second time in the row, you are inviting me to be there. Although virtually with you, I'm currently communicating with you from the capital of Romania in Bucharest. The next slide, please. I would like to start by presenting some very recent, very fresh epidemiological data. According to the WHO World Mental Health Report, which was just published a few weeks ago, of course, the data is pre-pandemic. We always have this time lag between when the data is received and it is published, but it's just 2019, and estimated almost 1 billion people, 970 million people in the world were living with a mental disorder. And the point prevalence was 13%. This is very close to what is the case also the last 20 years is around this 13%. From this evidence alone, we can very easily understand that mental disorders are a significant public health problem. Next slide, please. As you can see, the WHO European region is very high in the rank with 14.2%. This is our region. The 53 member states that consist the WHO Regional Office for Europe. Another significant concern is that people with severe mental health conditions die 10 to 20 years earlier than the general population. This vast yet hidden mortality burden of mental health conditions is, of course, as we all understand, of major concern. Next slide, please. Regarding the global burden of mental disorders in disability adjusted life years, the so-called DALYs, in 2019, across all ages, mental disorders accounted for more than 5%, 5.1% of the global burden. Next slide, please. Moreover, they are the leading cause of years lived with disability, accounting for 1 in every 6 years lived with disabilities globally, and this is more than 15%, 15.6%. Next slide, please. On this slide, we can see 4 different so-called well-being indicators each capturing how well or not people are thriving or prospering. First, limiting illness. Second, life satisfaction. Third, mental health. And fourth, self-reported health. Unfortunately, I have to say that we are not on track across all four. And not only that, there are huge gender and socioeconomic differences. Still, let's have a look at the bottom 20% of the population who reported lower life satisfaction. We observe that men in the lowest income quintile are over 3 times as likely to report poor life satisfaction as men in the highest quintile. At the same time, women are almost 2.5 times more likely to do so. Next slide, please. Can I have the next slide? Yeah. Even before the pandemic, mental health systems worldwide were marked by significant gaps in governance, resources, services, information, and technologies for mental health. Several factors stop people from seeking help for mental health conditions, including limited access to quality services, low levels of health literacy about mental health, and pervasive stigma. Can I have the next slide, please? No, the previous one, please. The COVID-19 pandemic has dramatically exacerbated the already substantial health and socioeconomic consequences of mental health conditions and has led to significant changes in the need for and delivery of mental health services. Specifically, anxiety, already pointed out by Professor Fountoulakis, increased in the general population, but for some, the pandemic has also sparked or amplified much more severe mental health problems. At the same time, mental health services have been severely disrupted, especially in the first year of the pandemic. Staff and resources were often redeployed to COVID-19 relief. In addition, social measures that we all experienced frequently prevented people from accessing care, and in many cases, fear of the virus itself stopped people from seeking help. By early 2022, there were fewer disruptions, but too many people still cannot even today get the mental health support they need. Next slide, please. In all countries, gaps in service coverage are compounded by variability in the quality of care. Quality includes how well mental health care aligns, first and most importantly, with the human rights principles, whether treatments meet any defined minimum standards for adequacy, and to what extent mental health care supports social inclusion. Among those people with mental health conditions who are treated, only a very tiny proportion receive care that meets minimum standards of quality care. Often, the range of interventions available is severely limited, with few alternatives, unfortunately, to biomedical-based care available. In many countries, mental health care systems also fail to provide the full range of psychosocial support that people living with mental health conditions can require. Next slide, please. The enhancement of mental health care requires multi-dimensional approaches. In this context, very recently, just a year ago, in 2021, the Pan-European Mental Health Coalition was launched by our regional director, Dr. Hans Kluge, and Queen Mathilde of all Belgians, in the presence of Her Excellency, also Deputy Minister of Health of Greece, Ms. Rapti, in Brussels, to drive the implementation of the WHO European Framework for Action on mental health, which spans from 2021 to 2025. The European Mental Health Coalition's three main goals are to transform mental health services. First, second, integrate mental health into emergency response and recovery efforts. And third, promote and protect mental health across the lifespan. Next slide, please. Another crucial step for the improvement of the quality of care, as already mentioned by João, and beyond, is the establishment of the WHO Athens Quality of Care and Patient Safety Office in April 2021 under the leadership of Dr. João Breda. Next slide, please. With the strong support of the Greek government, the office is already expanding by covering new workflows in the area of quality mental health services, focusing especially on children and adolescents. Next slide, please. At this point, and before we demonstrate how the quality of mental health care relates to the quality of life and well-being through the international literature, let's define the quality of life and well-being. So according to WHO, quality of life is an individual's perception of their position in life in the context of the culture and value systems in which they live and in relation to their goals, expectations, standards, and concerns. Next slide, please. Concerning well-being, according to the proposed WHO definition, it exists in two dimensions. First, subjective, and second, objective. It comprises an individual's life experience and a comparison of life circumstances with social norms and values. Next slide, please. With regards to the international literature, in a very important study published very recently in 2021, which aimed to assess and compare quality of life across different mental health settings, it was found that quality of life is positively associated with the satisfaction of mental health services provision. What does this mean? This means that higher quality of mental health care service provision is associated with higher quality of life. Next slide, please. In a literature review published a few years ago in 2019, it was found that a number of factors, 8 factors, were used to assess mental health care. Amongst them is the suitability of services, the accessibility of patients to services, the continuity of services over time, safety also, for example. And these 8 factors affect the quality of life, morbidity, mortality, well-being, as well as life expectancy, directly or indirectly. Next slide, please. And this is the last paper, but very important. As it can be seen in Bazou's longitudinal study, the quality of life construct has been used both as a dependent but also as an independent variable. The first case, as a dependent variable, is the more traditional use of the quality of life construct, e.g., something that both you, all the 3 of the professors in this table are very well aware. I'm referring to the clinical trials. Here, quality of life is used as an outcome measure to examine the effectiveness, but also the adverse effects of a particular therapeutic intervention. Thus, quality of life itself is an indicator of the quality of healthcare. Regarding the second case, as an independent variable, is a less used, more controversial, but potentially very beneficial application of quality of life. Here, the quality of life data gathered from a particular patient is used as an independent variable in predicting other outcomes. For example, in quality of individual healthcare or quality of care. In this usage, Quality of life is not an outcome measure, but influences it. Next slide, please. Lastly, a review published in 2014 found that improving mental health care through quality of life indicators is a goal for clinical research and practice. By addressing patients' concerns and taking into consideration quality of life, therapeutic alliance, patients, physicians interactions, and adherence can be improved. Next slide and final one. As a take-away message, I would like to emphasize the bi-directional relationship between improved quality of treatment or other forms of mental health care can be demonstrated by improving quality of life and well-being of the recipients of such care. Meanwhile, assessing patients' quality of life and well-being can serve as a method of improving mental health care by providing feedback. And my thank you slide, please. I would like to end my intervention with a statement made some 70 years ago from Dr. Brock Chisholm, the first ever Director General of the WHO. DG said at that time that without mental health, there can be no true physical health. And what DG, Director General, said at that time echoed what our Hippocrates, the father of medicine, said 2,500 years ago, that every disease begins from the psyche, begins from the soul. Thank you so much for your attention, and thank you for once more, Professor Anastasiadis, for giving me the chance to join you today. Thank you so much.
Well, thank you, Dr. Theodorakis. It was a pleasure to having you with us remotely, and we hope next time when we were about to present this initiative under WHO, you will be here. And also we will have the opportunity to have another session on well-being in the next AMF next year.
I hope so. Thank you so much, President. Thank you so much.
So we will now switch to the other